What is the roadmap to recovery from synkinesis? Well, we are going to discuss this in today's video. So if you are someone who is suffering from synkinesis, then this video is must watch for you. Let's get started. Can we cure synkinesis? Well, the answer to this question is the fact that synkinesis is not a disease. That's why it cannot be cured. Synkinesis is a mechanical problem where your nerves, either due to aberrant regeneration or else due to linked movements that is mapped inside your brain, don't function the way they are supposed to. That's why you will observe linked movements happening on your synkinesis. The three most commonest challenges that a synkinesis patient or sufferer will experience is number one, stiffness or tightness of the facial muscles. Number two is limited ability to move the facial muscles in isolation. And number three is limited capability or ability of your muscles to move in coordination. When we are able to fix these three issues, then you are out of synkinesis. But practically speaking, this is not 100% possible. But yes, it's absolutely possible to reduce to a significant extent so that your day-to-day life becomes as normal as possible. Your smile gets more symmetrical, more relaxed than it was before. So, what's the roadmap for this? Well, the roadmap is pretty simple and straightforward. Let me explain this. The synkinesis recovery process can be divided in three phases. Phase number one is called as relaxation phase. Phase number two is called as isolation phase, and phase number three is called as coordination phase. Let me explain each phase one by one. When it comes to the relaxation phase, the idea is to relax the tensed or tight facial muscles. Now, when I talk about facial muscle, I am not talking just about the mind muscles or else the muscle of your facial expressions. I'm also talking about the muscles around your jaw. I'm also talking about the muscles around your jaw and your neck muscles, because all of them play a very critical role. That's not all. Your posture also plays a very significant role. Here, when I talk about your posture, your neck posture and the posture of your tongue plays a very important role when it comes to improving your facial muscles relaxation state. Practices that aims in achieving this is ideal to be done in the initial phase of synkinesis recovery. That's where facial stretching, facial massages, myofascial release techniques are some important practices that we recommend to a person who is suffering from synkinesis. Next comes the isolation phase. Here the training is all about blocking the unnecessary synkinetic movements, which we at HQR call it synkinesis blocking exercises. These exercises are set of practices which works on negative feedback to block or remove the unnecessary facial movements. From there, we progress towards training the patient's facial muscles to be moved in isolation, which means individual contractions. Here, the aim is to teach the facial muscles to move in the right directions at right timing. When this phase is gone, then we work towards coordination phase, where the training is all about building a sync and connect between the affected and the non-affected side. Here, the practices are more about your expressions, linked movement, coordinated movement on both sides of the face. We use different tools like mirrors, apps, etc. to get your facial coordination as best as possible. Now you must be wondering, how long does all this takes? Well, you have to definitely be prepared for 1 year of time to get these results, because here consistency is the key. We are working on the principles of neuroplasticity. That's where whenever you are able to consistently give practices to your facial muscles, you are going to remap your nerve and the brain connection, and you will be able to get better movements on the face. That's why it's not more you practice that will give you better result, but how consistently you practice will give you the better result. Ideally, a practice done for around 30 minutes 2 times in a day is one of the best practice that you can do to achieve results from your synkinesis. If you who are someone who is suffering from synkinesis and you want to work towards it, make sure you follow this three chronological order, which is relaxation, isolation and coordination. If you don't follow this, what happens is you might end up getting some results, but they will be haywire. Let me explain how. Let's say if your muscles are very tensed and if you directly focus on training your muscles to move in isolation or else in sync, or else you directly focus on blocking synkinetic movement, you might not achieve the 100% or you can say best outcomes. Why? Because that tension is always going to rebound back and will limit the results to show up on your face. But when you relax your facial muscles well, and then you start training your facial muscles to move in isolation, what will happen is your muscles will exactly know at what levels, at how much contractions the muscle needs to contract to achieve that optimal movement, which is only possible when a muscle is at relaxed state. That's why sequencing of the practice is very critical. Apart from that, certain lifestyle modification are also very important. For example, your posture. The posture of your tongue, where your tongue supports or stays rested on your upper floor of the mouth and your teeth are slightly apart from each other, is an ideal resting posture for your mouth, which limits or minimizes overwork of muscles like masseter and temporalis, which are the muscles of your mastication. Along with that, your neck muscles like sternocleidomastoid and the neck extensor and flexors, when they are tight, they will also give you more forward neck posture, giving a downward pull on the face and limiting the facial movements. That's why posture correction is also very critical practice that you have to do in your daily routine while you're working towards reducing your synkinesis. So I hope that through this video you were able to exactly understand what is the chronological way or else a roadmap to recover from synkinesis. If you've got any further doubt, you can definitely reach out to us so that we can help you better. On that note, I'll end this video here and I'll see you in another video. Thank you.